Hi. So part of my goal with News Not Noise is to empower you with information that helps you make decisions that improve your lives. Sometimes that means breaking down complicated ideas in politics or the economy. Sometimes it means telling you what insiders know. Again, all so that you have more information to make important decisions in your lives, sometimes less important decisions. A few weeks ago, I posted a joke slide that was sort of making fun of celebrities and influencers who say that they look decades younger because of the little bottle of moisturizer that they use and nothing else. I cannot tell you how intense the response was. So many of you messaged saying, what is the real? Does this stuff really work? What goes on behind the scenes? And so I decided to actually take these questions to an expert. So I am bringing you now a top plastic surgeon from New York, Dr. Lara Devgan. Many of you already told me you know her. You follow her on Instagram. She is attending plastic surgeon at Lenox Hill Hospital, Greenwich Hospital, and the Manhattan Eye, Ear, and Throat Infirmary. She's an editorial consultant for the Lancet, medical expert for ABC News, and founder and CEO of the skincare line, Dr. Devgan Scientific Beauty. So let me bring her in and I'm going to put your questions to her. Hi.
Hi, how are you?
I'm well. Thank you so much for doing this.
I'm so happy to be here.
Before we start, just found out we went to the same high school.
Are
you a Harvard Westlake grad?
Harvard Westlake. What a small world.
It's a small world, but you're in New York now.
Yes.
Okay, you are as much an expert in all of this as it gets. I thought I'd just start with a straight up question. I see all these influencers posting all the time that just this little bottle of moisturizer has made them look young. And I'm from LA, as you were. I happen to know that there are things called mini facelifts, lasers, peels. What's the real? If you're a celebrity over 40 or an influencer, what does that beauty regimen likely entail?
I mean, likely what you're thinking about is a little bit of neuromodulator like Botox, a little bit of injectable filler to replace lost collagen. And the reality is there's been a huge trend toward minimally invasive cosmetic enhancements, including smaller procedures at earlier ages. You can do something like a little mini facelift in 2021 and have the incisions completely hidden behind your ears and under your chin, and you look basically the same, but a little bit fresher. And I think that it's more that than olive oil.
Right? I love the honesty. You know, we're not saying you got to do
I
this.
love olive oil. I do.
You don't put it on your face, do you?
No.
Okay.
I mean, on my pasta.
Okay, good. What is a mini facelift? You said an incision here and here, as opposed to what's an old-fashioned or big facelift?
So facelift is kind of a colloquial term for rhytidectomy, which means lifting of the deep substructural tissues of the mid-face, jowl, and neck. And a face and neck lift can mean a million different things. Plastic surgery is kind of like commissioning an artist to make a very high stakes and very specific painting for you, and hopefully very beautiful painting for you. So it can look like anything depending on your anatomy and your goals. But a facelift typically will involve incisions hidden in front of, inside, and behind the ear and under the chin. The deep plane or SMAS musculature of the face or the platysma of the neck is redraped, and then the skin is kind of spread nicely on top like a bed sheet.
How long does recovery from that sort of thing take?
Patients have stitches in place for about a week, and you look restaurant ready at 2 weeks and ready for anything at 4 weeks.
So that old look where people are banged up and bruised, that's yesteryear.
Bruising and swelling are certainly part of the process. I mean, and I think plastic surgery in the media gets essentialized into a before and after photo, and that can kind of minimize what happens in between. So you can get a little beat up looking. I will say though that the modern generation of plastic surgery doesn't look like the media caricatures from 15 or 20 years ago. It's not all about a tight, puffy, taut looking, oddly wind-blown face. And I think the idea of a modern enhancement is you actually maintain some natural imperfections in the interest of global facial beauty. And that's what truly allows people to look ageless. When you see a celebrity who's looked basically the same from age 25 to 50, that's not an accident.
And what you're saying again is that they get, in addition to the mini facelift that you just mentioned, there's Botox, which straightens out wrinkles, filler that adds fullness. What are some of the other things you mentioned? Did you mention threading, or is there
There is,
lasers?
there's an endless number of possibilities, but basically there are three things that you can think about structurally happening with facial
Okay.
aging. Atrophy of the tissues, and that means shrinking of the naturally, plumper, full stuff. Like, for example, lips peak in fullness at age 14 to 18, and every year thereafter they become slightly smaller. So that's atrophy. The second thing that happens is descent. So tissues that were high get lower, and that you can see that like maybe with the eyelid or with the jowl. And then the third thing that happens is loss of bone structure. So that structural skeleton of the face actually involutes. So you don't just get osteoporosis in your hips and femurs, you actually can get a shrinking of your facial skeleton. So that's kind of like what's happening. And then the procedures that we can use to address that really can be targeted to an individual. So you can do something called suture suspension lifting, which is the modern generation of thread lifting. And that's a very cool technique where we use a tiny needle prick site, like just a little needle prick site, and use a barbed surgical suture with perpendicularly oriented rasps that gain purchase in the tissue. And you can use that to lift and sculpt the face along certain vectors. And that's a really cool technique. You can also use injectable fillers to sculpt and contour the face. You can do something called blepharoplasty, which is eyelid surgery, to help with hooding of the upper lid or puffiness and bags of the under eye area. There's lip lift, buccal fat pad excision, submental liposuction. I mean, the facial anatomy is one of the most complex things that you can talk about.
And it definitely is not going to be addressed just with a moisturizer. Okay. So at what age do you think people who are in front of the camera start getting things like Botox and filler in some of these procedures?
I mean, I think it can vary. I think when you see somebody who looks great, you don't really see the work that's being done. And when you see examples of something that looks off or unnatural or a little bit overdone, those are the examples of not great work.
Right.
And so tiny little interventions like micro droplet Botox to slightly improve the arch and position of the brow, or a little bit of microinfusion, microneedling for skin quality, those things happen early in their 20s. And in terms of, celebrities and interventions, I think the public can be very cruel to people who are in the public eye. And while there is a part of me that wishes more people would come clean and say, okay, this is what I'm really doing, I'm going to break it down for you, I also, in getting to know some of these beautiful, frequently photographed people, I do feel some sympathy for the amount of cruelty and scrutiny that, trolls will put upon them, and kind of shaming them for just wanting to keep their jobs and, feel confident in front of the camera. So I do think it cuts both ways.
Absolutely. I take a slight issue with people who say it's all in my skin cream. Buy the skin cream. I haven't done anything else, because that's not truthful. But
I mean, I have definitely read a magazine where I've read someone say, I've never done Botox. And I have thought to myself, I've literally done your Botox. So I get what you're saying.
I mean, I'm in the truth business, but yes, I know. It's challenging to be in that. Like, I used to be on TV and people they get cruel to you for just nothing. Let's talk a little bit about COVID and how COVID lifestyles have sort of changed the beauty business. Apparently, business is really booming. We found one statistic that in just one Cincinnati office, they said injectable procedures like Botox and fillers were up 90% compared to the same time the year before COVID. I understand last year Americans spent $16 billion on cosmetic surgery, and 11.7 million people had non-invasive procedures alone. Do you have a theory why are people rushing for plastic surgery right now?
I think it's a few things. First, I think we're all trapped indoors and we're scrutinizing our faces more than ever before. It's been a very destabilizing and tragic year for so many people, for so many more serious and frankly more important reasons. You know, people have died, people have lost their jobs, gotten divorces, lives have been totally destabilized. And I think being trapped indoors, looking at yourself in the mirror, or for more often than not on a Zoom camera, has caused us to see all these little imperfections in our faces. I think during the height of lockdown, we all watched our gray hairs grow in and our Botox fade away, and the stress and cortisol levels of just not knowing what was happening in the world with the pandemic and everything else, it caused a lot of aging. Kind of the way you see US presidents age a decade in their first year in office. We all aged like a not insignificant amount this first quarantine. And so I think that's number one. Number two, there are a lot of people who have, in a rational and reasoned and well thought out way, had some things on their mind that they don't feel totally comfortable or confident with. And this has given people an opportunity to be a little bit more, free to have time where they're working from home and not traveling and not going to events. And then I think the third thing is that it's also been a time where we're really reevaluating what it all means. And the idea of self-improvement and kind of wanting to be your best self, whether that means working on your abs or learning how to bake banana bread or being nicer to your kids or, straightening out your nose that you've always been thinking about that's a little crooked, or getting rid of these furrow lines that make you look mad when you're really happy. I think these things are all part of what it means to feel confident.
It all makes sense. And they have recovery time now too, because we're all in hiding a little bit.
Yeah, and then you've got this big mask covering the lower half of your face.
That's what I wanted to ask you about. So I've heard anecdotally that because we're wearing masks, people are requesting different kinds of surgeries. Like we're noticing different parts of our face. Have you seen that?
Totally. And it's blown my mind. I've seen so many increases in requests for procedures of the upper third of the face. Imagine I'm wearing a mask. You're looking at the eyes, the eyebrow, the forehead. So everything from suture suspension lifting, brow lift, eyelid surgery, tear trough augmentation, Botox. This is like the zone of action, because think about it, when you walk around in the city, or, if you're walking around outside of your house, the only part of your face that you're presenting to the world is up here. And that's the
neck.
Yeah. And there's been also a huge increase in procedures of the face and neck. And this, I think, is because you have to see it. And this is because you get to cover it. So we've been doing a lot of lip lifts, face and neck lifts, jawline contouring, all kinds of stuff.
Crazy. Is plastic surgery up for men too?
It's pretty stable for men, but up generally speaking. About 15% of my practice is male, and about 85% is female. The men tend to be more private about sharing their images. So my, Instagram feed and before and afters tend to represent male patients less frequently.
Right. It's interesting. So a broader question, it used to be the case that sort of a white beauty standard was the beauty standard that many people went for, no matter their ethnic or racial background. Have you found that increasingly that's changing, and that while there might be still an unrealistic beauty standard, it's more specific to a look that's true for Black women, a look that's different for Latino women, a look that's different for Asian women?
Yes, and to me, this has been one of the most amazing changes in my industry. Plastic surgery, the media character of plastic surgery is this superficial, cringeworthy, ostentatious field with exaggerated proportions and all of that stuff. I think the advent of social sharing, the use of our cell phones, apps like this one, have allowed people to really become more globalized in their beauty standards. And I really think of modern beauty as the permission to be your own kind of beautiful on your own terms, whatever that means to you. So there has been a huge rise in what I sometimes refer to as tweakments or facial optimization. Whereas, 10 years ago, people would bring in, 10 years ago, people would bring in a picture of a celebrity from the cover of a magazine. Now people bring in a picture of themselves slightly face-tuned and photoshopped. And so the new beauty standard is leaning into yourself, but maybe optimizing your own naturally beautiful features and kind of improving the way you feel confident, but anchored to a beauty standard that's more your own. We're also specifically seeing more trends that are borrowed from other parts of the world, like, you know, fullness of the lips. I think in the past 10 years, in the 2010 to 2020 era, there was a huge increase in requests for buttock enhancement and curvaceousness of figures and things like that. Like, definitely not the wafy heroin chic model of the 90s.
Right. Now, what do you say to people who would question even our conversation, that even the discussion of plastic surgery publicly diminishes self-esteem and leads to insecurities, leading people, especially women, to dislike themselves?
Yeah, I mean, I think that plastic surgery is a complex topic, and if it makes you feel destabilized and you don't want to do it, then you absolutely shouldn't do it. What I would say is that people are much more complex than, you know, the dichotomy of either being a superficial plastic surgery junkie who's obsessed with their looks and, you know, a person of substance. And I frankly, as someone who considers myself a woman of substance, but who also likes, you know, a cute headband and some lip gloss, I don't like the idea that you have to be black or white. We all exist in this gray area. And I truly believe that you can be a person of substance and maybe not like your crow's feet, or you can choose a cute outfit that makes you feel confident. And obviously plastic surgery is a much more serious decision than that. But the fact that there has been such a social stigma about plastic surgery has truly driven this industry underground and likely contributed to the deaths and disfigurements of thousands of people. You know, the shame in talking about modern medical responsible procedures that adults and willingly consenting people can perform and do, you know, that shame has led to back alley illegal situations and disgusting hotel rooms, unlicensed practitioners, horrible scenarios because people feel uneducated about the procedures that are out there. And I think that, you know, whether or not you want to have plastic surgery is your own decision. Whether or not information about it should be withheld from others, I think the answer is clear, that more information is always a good thing. And there is a way to frame plastic surgery not as this self-diminishing, self-abnegating field that makes you feel less than, but as a field that allows you to feel like the best version of yourself.
I'd love to ask you a couple audience questions.
Okay.
Okay, here we go. I'm sure you, okay. What are the long-term effects of Botox and filler? Once a person starts, do they have to always do it?
You do not have to maintain them. You can do Botox or filler one time and never again. A lot of times people like it, and so that can contribute to their desire to maintain it. But Botox is a neuromodulator that smooths out wrinkles. It lasts for about 3 months. Injectable fillers, when done well, last for somewhere between 6 months and 2 years, and they stimulate the body to produce its own collagen, so it can be helpful with long-term aging.
Does face yoga really work?
No.
You have to say that.
That's a hard no.
Do these work? Cryotherapy, LED light masks, and microdermabrasion.
Microdermabrasion is going to give you a little resurfacing of your skin. Cryotherapy, I think, can make you feel good. It can give you a little transient shrinking of edema or puffiness in the face, but probably not a long-term answer. And LED light therapy, there's a little data that suggests that red and blue light wave frequencies can decrease acne-forming bacteria or help slightly with anti-aging, but the stuff you can buy on Amazon or over the counter is not medical grade, so probably not going to help you that much.
Are there at-home devices that are good?
Generally speaking, I don't suggest at-home devices because I've seen them do more harm than good. Either they're not effective because you can't sell medical grade stuff direct to consumer, or they are somehow in a backdoor method medical grade and you're going to really hurt yourself.
That makes sense. What is cool sculpting?
Cool Sculpting is a brand name for cryotherapy, which is using a cold paddle to freeze fat cells. I'm not a fan of it because it can look irregular and cause a phenomenon called paradoxical adipose hyperplasia. So you think you're going to get slim, but it actually gets a little fuller.
Oh, that's not a good outcome. Okay. Somebody asked, the biggest question we got in many, many forms was, how do I undo the 100 years of aging I've developed in the last 12 months? And then the other question is, how do I do it if I don't have a big budget?
Yes. So I think that is that. If you find out, let me know. But I'll tell you what I know. I'll tell you some limited things I know. If you're thinking about simple and inexpensive things to do for anti-aging, you can do some things just with attitude and behavior alone. So sleeping on your back helps avoid positional wrinkles. You know, if you sleep like this, you're going to get a deeply etched nasolabial fold. I can't believe I just did that.
You're not supposed to squeeze it. Okay.
You should also talk with your hands instead of scrunching up your face, because that helps avoid the development of deeply etched facial furrows. And then in terms of skincare, a very simple edited medical grade routine of a hyaluronic acid serum, a retinol bakuchiol, vitamin C, B, ferulic, some peptide based moisturizers, and SPF. You know, you can really accomplish quite a lot in that way. I think of at-home skincare almost like brushing and flossing, and your in-office visit where you do your lasers and injectables as your twice-a-year cleaning with your dentist. So even if you don't go into the dentist, you can, my dentist, please don't kill me, but you can still accomplish a lot with a little bit of daily maintenance. So if you're on a budget, I would focus on some of those little simple things. Maintaining a healthy lifestyle is a little cliche, but that's because it gestures toward the truth. And, you know, leafy greens, high protein diet, staying well hydrated, adequate sleep, trying to decrease your stress level, those are things that all help. And then if you have a little bit more of a budget, I think that a judicious approach to facial aging can be an extremely conservative and natural looking, like dabbling of potentially a combination of injectables, lasers, and potentially surgical procedures, but it's very case by case.
Wow. That was a very substantive answer for starting off with, if you know, let me know.
I'm speaking to Jessica Yellin. I couldn't just say some fluff.
I love that. That was so good. Okay. This is a question I need to ask because I haven't been to the gym since before COVID, but I'm obsessed with butt implants. I have seen so many people who get butt implants and then they fall. Is this, and it's the worst look ever, is this a trend that's going to go away? And do butt implants ever stay up where they're supposed to be?
You know, I think buttock implants are one of the less predictable and more complication prone procedures in plastic surgery. They're right next to the, you know, perirectal canal, which is an inherently dirty area, even in the cleanest of human beings. They can tend toward malposition and displacement because you use your buttocks quite a lot when you're seated and standing. You know, it's not the best procedure in terms of kind of long-term satisfaction. There's also been a huge increase in the past 10 years for autologous fat transfer or Brazilian butt lift. And I think that some of the examples we see in the media are very exaggerated. And I worry about how those people will age, because when you create a very distended tissue envelope, it's heavy and you're asking a lot of the skin to hold it up. So, you know, we know what happens with heavy tissues and weak skin and time and gravity, and that's descent. So I don't think that it's going to be a beautiful long-term outcome.
I love that we're ending this week by talking about butt implants. I cannot tell you what a relief it is. I feel like I'm the Grim Reaper, and I'm always bringing everyone awful news. So I'm so happy to have this conversation with you in a substantive way. You are so thorough. So in the end, basically, when you have a red carpet look, chances are it has to do with a lot of time in an office like yours and not just their at-home beauty routine.
Yeah, and for any, you know, young people or not so young people listening to this, you absolutely should not judge yourself by the beauty standards of celebrities you see on the red carpet. There's not only a huge medical team that's helping with many of those situations, but a huge, you know, photography and airbrushing and makeup and hair team. That's really somebody's profession. In the same way you put all your love and care into making a beautiful, perfect Excel spreadsheet, they're thinking about their appearance in that way. And, you know, I think that more transparency is needed, not only to allow people to understand this industry to the extent that it's interesting to them, but also to the extent that they feel sort of oppressed by the idea of impossibly beautiful people that they see. There's a lot of hard work that goes into that.
I guess I just want to ask you one more question. You have kids. What do you tell your kids when they look at the perfect celebrity model?
It's so interesting. I want my children, so I have 4 sons and 2 young daughters, and they're a little bit too young to totally understand what I do. But I want my kids to feel beautiful and perfect exactly as they are. And I often think about, how do I reconcile that with my job, which is literally helping already beautiful people look more beautiful. And, there's, moment of silence for the mind-blowing concept of that. But I think that I want my kids to feel confident, but at the same time, if they have a problem that is really bothering them and hindering them from feeling confident in situations that they want to be in, and they're at an appropriate age and kind of maturity and mental bandwidth to handle some of the ramifications of a procedure like something I do, I would not have a problem with enabling and helping my children to make a decision that I thought would help them. I think the first thing that I say to all of the patients that I see in my office is, you look great as you are. This is elective. You don't need this. And I think that plastic surgical procedures should never come from a place of insecurity. Nothing that I do is going to save your marriage, get you a job, make somebody fall in love with you, or change your life. It's going to give you the emotion that like a great lipstick or a beautiful dress will give you, which is you'll feel happy, you'll feel confident, it'll put a pep in your step, you'll like it. But the fundamentals and starting from that great internal space have to be there. And I think body dysmorphia is real. We have to always be on the lookout for it. We should never be pushing procedures onto people who are feeling uncertain or vulnerable or depressed or, other things that aren't good. And within that frame of reference, I think this is a field that can bring people a lot of joy and happiness. And I'll just throw in that plastic surgery is so much more than Botox and breast implants. My training is in complex craniofacial reconstruction, burn wounds, hand surgery, breast cancer reconstruction, free tissue transfer, microsurgery, cancer, trauma, reconstruction of facial bones. It's a very broad and beautiful field. And one aspect of it is the kind of stuff you see on the E-Entertainment Network. It's much more than that.
You're fantastic. Thank you so much for your time and your honesty. This is exactly the conversation I wanted to have. I think it really empowers people to actually get the real. So thank you.
You're so welcome. Thank you for having me. I'm a huge fan and I really enjoyed it.
I'm so happy. People can follow you at, is it Dr. Lara Devgan or is it at Dr.
Lara Devgan, MD is my main medical practice and Dr. Lara Devgan is my skincare line.
Great. I'll make sure we post that. Thank you so much. Have a great weekend.
Good night. Have a great weekend.
Good night.